Good morning, Maryna.
Good morning, Dr. Dwight.
Thank you for meeting with me this morning.
Thank you
We've
for
been
inviting.
talking about doing this for some time. There's certain specific reasons I liked your the experience you've had uh, in coming to me as a chiropractic patient from before, and having a different experience in our office. Plus, I love working with athletes, competitive high-level athletes, and you have an interesting experience that you will share with us, please, about your athletic experience. And I'll maybe add some points as you go and explain about what you're talking about. Okay?
Yes.
So go ahead, please, and just maybe give a brief explanation of who you are, very brief, just where you live and where you come from, and then maybe you can start on your experience in the past as an athlete.
My name is Maryna Barova. I'm an ex-athlete. I'm a figure skater, and I'm Ukrainian, but right now I'm working in Italy. I'm a figure skating coach. So my backup experience as an athlete was in the United States. I was a professional athlete, and I had to do with the sport my whole life. And the sport includes many issues. And also, when you are a competitive athlete, you have the traumas and all this stuff. So I'm pretty common with the chiropractic experience my whole life, because athlete must take care of himself, herself all the time. And I would say that there are some parts of my body that were bothering me all the time. But lately, I'm talking about last 5 years, I had a consistent pain in my dorsal spine.
The mid part of your spine, the thoracic area.
Yes.
Excuse me that I interrupt you before you go forward. I don't want you to lose your thought. But I don't remember you telling me that you've had chiropractic all of your life. Is that true? From when you were a young person, a young girl?
Yes, like since I was a teenager.
Oh, okay. Yeah, now I do remember teenager. Yes. Okay. So you started your athletic career started basically when? When did you start becoming became a professional athlete?
Well, I started skating when I was 6 years old. And I guess around like 10, 11 years, when I was 10, 11 years old, I was kind of more involved to do it professionally with my family. So from that on, once you're a teenager, you grow, your body changes, and you start to have some issues because you have to spend lots of time figure skating and doing other activity. It's not like a normal gymnastic stuff. And
So you started, excuse me, you started in Ukraine. Your
yes.
career started there. And when did you make a shift? When did you, I think you said you moved to Canada. Is that correct?
First of all, I moved to US when I was 12. And lately on, I moved to Canada when I was 16. And then back to US when I was 18. I was a figure skater and an ice dancer, so I skated with a partner. But yes, it was an individual thing. Well, first of all, I started to get great results. Right away, I have noticed the difference because everything was different. I'm talking about the technique and all the, some small details, and also the amount of preparation you do off the ice. Then lately, just give you higher and bigger results. So just you have to eat properly. You have to work with your psychology. You have to take care of your body all the time, including the massages and the chiropractic therapy. Like you really have to take care of yourself, so the perfect condition in that one moment once you need to compete.
So was it your choice to go to chiropractic care, or was it given to you from your coach or somebody?
I think it was kind of my idea because even before I moved to the US, my parents always were making for me appointments at chiropractical, and I kind of saw that it helped me at some point, but then the results, like, they were gone. And I was just trying to figure out why I feel good right away and for some small period of time, and then once again, like, I'm in pain. So I
Right.
was thinking maybe I have to do it more consistently.
Okay. All right. So you were, when was it that you were at the height of your competition? At what age were you
And
more
this
involved?
17,
17
once
years
I
old.
was in Canada. Yeah.
Okay. And did you have a specific injury, or was it just the stress of constantly doing intense trainings and so forth?
I haven't had like big injuries. I had some big ones that they were like, they came and gone. Like, I had a brain concussion when I was little, when I was 13 years old, but it was kind of, just this case when you fell and then it happened. Once I was 17, I haven't had any big injuries, but I always felt that my body was stiff at some point. Like, when you practice this sport 6-7 hours per day, yeah, we were doing also the stretching with my partner and stuff, but this feeling of stiffness never left my body, even if I was doing some therapy.
Was it a general stiffness, or was it related to a specific? I know that you had the thoracic pain when you came to me in the beginning. Was it specifically there, or was it in general?
It's in general, but also like my legs, I felt the stiffness and I felt the cramps all the time in my legs. Doesn't matter what I eat or drink. I had those
Uh-huh.
cramps. So I guess also the amount of practices I was doing, they were not too much, but maybe something wasn't going well.
So how many hours a day were you training when you were in that period of what, 16, 17 years old?
I was training 6-7 hours per day, and it was like for 6 days a week. I stopped competing when I was 18. It wasn't my desire, but my skating partner, he told me that he wants to concentrate on the studies. So he stopped skating and I was basically left alone. I tried to look for another skating partner, but at the high level, it's not so easy to find a suitable skating partner. So from that time on, I started to practice rarely, and then I noticed this pain in my dorsal spine.
So do you have an idea of when it started exactly, the pain, this pain in your spine?
Mm, the
That
pain that
specific area, that specific thoracic area that I
um,
know you came to me with.
yes, I know what you're talking about. The specific pain, like the one that really bothered me, started when I was like 20.
Okay. All right. And how old are you now, Maryna?
28.
Okay. So that started when you were 20 years old. And I know when we spoke, maybe you can mention briefly that you went to the chiropractor and you were getting some results, but as you said before, it was that getting a relief, but then coming back. Is that right? It
Yes.
continued like that way. Okay. So you moved to Italy when?
When I was 19, I moved to Italy first time. I worked in Padova for 3 years.
What were you
And
doing in Padova? What work were you doing?
I was a figure skating coach, always a figure skating coach. I was,
Okay.
continuing with my passion. And yeah, I've noticed some difference because I'm working with all the levels, all the edges. So when I'm bending with the kids and I kind of have to lift them up, like when
Uh-huh.
they're doing the first steps and stuff, I notice this pain more and more. I started to notice it more. But I'm tough. It's not like okay, I
You give
have
in.
pain, I need to stop.
You
Like,
stop.
okay, I have pain, but I'm an athlete, so maybe just not a good day. But
I
then,
rarely find an athlete that doesn't have pain
yes,
during
exactly.
their
So yeah, I tried to figure it out. What should I do and how can I fix it?
right.
So I started a few treatments with chiropractic, and
Where
I
you were
had
in Padova? In Padova?
yes, yes, and also in Ukraine because I was flying back and forth.
Right.
Um, so I had some good results, but they didn't last. That was bothering me. So I have to mention that before I came to you, 1 year ago, even 1.5 year ago, before I came to this zone of Italy, like the Friuli Venezia Giulia, I had a surgery in Ukraine. I had a lipoma. Maybe you can explain what kind of stuff is that, but in the area where it bothered me the most, my dorsal spine, I had a lipoma, and I made a decision to cut it out. So I recovered from this surgery, and then I came to Italy, and I thought that everything will be great, and it was
I,
good for some period of time. But later I noticed that still there is something that bothers me there, and I couldn't understand what's wrong. So I guess it's a little bit kind of a destiny, because I have lots of athletes here in Italy, and the mom of my two athletes, she told me that she knows a good chiropractico in Udine, and that her aunt goes there like for 30 years. And I was kind of thrilled to hear this story, and I gave it a shot. And
right.
I made an appointment with you, the first appointment, where you asked me lots of questions, and you tested me, and you just kind of showed me how my body's turned and twisted due to the work I do. And yeah, from
Was that the first time a chiropractor had spoken to you about that kind of situation that you were in, or did somebody else tell you that before? Was that
you were
new to
the
you?
more you were the more detailed one, but yeah, many chiropractical, they spoke to me that I'm a little bit twisted and stuff, but you made lots of examination and stuff. I thought I really saw that you were into the details. That's what I love about you as a professionalist. It's a great thing.
Thank you. Yeah, that's interesting. You said I have been in practice for 40 years. So I've had an opportunity to work with professional basketball players, professional soccer players. I've worked with Olympic athletes. And it's like the example I use, when you work with an athlete, it's like working with a Ferrari as opposed to a Cinquecento. I don't know if that's a Fiat. Let's put it that way, without putting down anything about Fiat. But you can be. It's really very interesting as from the point of view from a technical perspective as a chiropractor, because you can be extremely specific, and immediately the athlete's body responds, and you see either what you're doing is either working or it's not working. You get a sense almost immediately of how this person is going to respond, also going forward. So if that for me has also been always been an exciting part of the work with athletes. Going back a second to the idea, the story about the lipoma, I had actually forgotten the details of that. But that's kind of a typical situation. In your specific case, I believe your body had developed like a sort of callus, un calo, in
Mhm.
the area from the tension. Um, what I found in your specific case through the examination, the more detailed examination that I did, is that the tension was not being generated. It was not coming from that specific area where you had the pain. That area was the point of tension was more of a consequence than a cause. The actual cause was coming from the sacral spine, from your pelvis, and the
Mhm.
upper cervical area, the area up high in your neck. I probably noticed I work in great retail with this, specifically with this upper area. So if I was to take an elastic band from one end and hold it, and at the other end hold it and stretch it, where's the tension going to be? It's going to be in the middle. Okay. And if you pull it and you keep pulling it and pull it, then obviously the rubber band's going to break. More likely in the middle, as opposed to the ends where I'm generating the tension, pulling it apart. So that's kind of a metaphor. It's kind of an example for what happened in your case, which is also very common. It's the difference between doing a therapy as opposed to doing what I would call a healing, or a more of a cause related, a functional type of approach to a problem. Where's the function? Where's the function missing? Where is it, and where is it missing? What is generating the tension? It's typical for most therapists, I've seen over the years, to immediately go to the area of pain and concentrate on that and try and do whatever they can to get the person out of pain, so that obviously the person feels better, and they can continue maybe eventually to do more work, or maybe even stop at the point of pain, which it took me many years to learn this, obviously, with experience of working with a lot of athletes and a lot of people, that you have to look to cause. You have to look to where's it the pain being generated from. And in your case, it was pretty obvious. So yeah, that maybe was the difference, as opposed to obviously working with a person that doesn't have that kind of a body, that kind of physical prowess, that level of functional tone. It's obvious you don't have that opportunity to work so much with that kind of a person. In your case, and especially because you're younger, obviously that makes a difference too. I don't know if that maybe helps to explain better why or what happened in your specific case.
Maybe also my body responded nicely and faster due to all these processes, because I'm an athlete, like our body recovers differently.
Yes, absolutely. Yes, yes, that's what I was trying to get to. Yeah. So you started with me, and you did that surgery. I remember that now, looking back, and that's dangerous, because that's what happened. If you focus only on the pain, treating the pain, you maybe go through a physical therapist or other people, and you get some relief, and you end up in the orthopedics office or neurology, and maybe a neurologist's
Hey,
office. In your
excuse
case,
me, just
are we losing
yes, we're losing. My boyfriend says that we're losing. Maybe you can start the sentence once again.
Okay, no, I was just actually following up on what I had said before. Is that it's risky. You risk doing more damage if you're not careful about identifying the causal, the functional problem that's generating the pain, because you went through surgery and you were lucky, because I've had patients that have been in similar situations where they've had the surgery and there's risk involved, and maybe they had some residual negative effects from the surgery. Obviously, if you're not treating the cause of the problem, you're going to have some sort of you're going to have some negative effects as time goes on. Okay, so you came to me in January, and we started. And just go ahead and just explain what the process, what we went through, the treatments you did, maybe what you felt as we went along.
Yeah, after the first appointment, once you examined me, you have sent me to do some X-rays. And also this, a little bit just pumped into my head, because I wasn't sent before right away for the X-rays and stuff, but like those details that you wanted to find the cause, you wanted to see all the picture of the situation. It's kind of, just hooked me a little bit. So I did the X-rays, and then I came to you, and then you told me that the dorsal spine is not a problem. The problem is higher in the neck. And that thing really shocked me. I remember that day, and yeah, it was a big event for me, that the cause is my neck, and also a little bit lower over there. And we kind of just started with the treatment. You told me that you're sure that you can help me, and I trusted you right away, and I jumped in with this great experience. And I have to notice, because I was telling my family that it's a miracle, because after the second treatment, I remember it nicely, after the second treatment, the pain in my dorsal spine left me, and it didn't came back. And let's say it was just the second week of a treatment. So it really, just shocked me. I remember it. And doesn't matter what activity I was doing later on, because I was working with the kids. I was also, lifting the little kids. I was bending a lot, forward, backward, but the pain was gone, and I was really happy about it. And then I understood that once a week I have to, give it a shot. I have to do those treatments, and then just given a consistency, because consistency is everything in everything you do in life. With this consistency, we can achieve great results, and we can fix my neck and all the other parts of my body that they were not really into a great position.
What other changes did you feel apart from the dorsal spine? Did you have other changes that, as a result of going forward in time, with any other part of your life or your body or your health? Did you
Yes,
notice something?
I noticed that I became a more calm, and that my digestion changed. And overall, I felt more in resource, if I can say so. Like, I felt tiredness, and I was all like full of energy. And yeah, like first I remember in general I had the insomnia. I was a little bit in that kind of shape. Maybe it's also common for the winter time, but I remember that after your treatment, after I gave this consistency, like with every week I felt only better and better.
Great. And I don't think I ever touched your dorsal spine where you have the problem, where you had the pain. I don't
Exactly.
remember.
Exactly, yes.
Interesting. Okay, great. Any other comments you'd like to make, Maryna? That's great.
Well, first of all, I'm really, really, really grateful that I found you and that you took care of me, because really you made a change to my life. Like, that's that's a miracle that my problem is gone, because I had this problem for years, and no one, I passed lots of doctors, no one could really help me. And also the fact that I insisted with my surgery when I had this lipoma, this tumor, like, yeah, that was odd. I was really, just kind of lost, and I couldn't understand what else should I do, because that was strange for me. First of all, like just passing my whole life in sport, and then having this problem, and no one can help me, and everyone says that pretty much you are healthy, but I wasn't feeling the same way. And you really made a change, a huge change to my health, to my good being, and I'm really grateful. A part of that, like, you are really the person that involves with the patient spiritually, and with the psychology, and you help to recover also in all those aspects, because every aspect is important for all these mechanisms.
The process, yes. You can't
Yes,
separate the mind from the body and the
yes.
body from the mind. They're together. Well, thank you for that. I really appreciate it. It's been a pleasure for me. You've been a great patient.
Thank you.
You know,
Thank you.
you're very consistent. You didn't make excuses about coming, not coming. Obviously, you saw the results. But it's really is a pleasure to work with athletes like such as yourself. Um, Going forward, if it's necessary, how often you should come, how often you should not come, which just depends on how you live your life. You know, how much stress you have in your life, and what occurs, anything that's new. And I know you're continuing to work the kids, um, and there's going to be things. But now that when you come into it, I get to get adjusted. It's really new things come a little bit, and I just adjust you according to what I find. But the old problem, really, I haven't found any specific residual from what you had before. I've noticed that there's no need for me to repeat certain things because your
Yeah,
body continues to change.
I remember you told me that now that just we have speed up the process of my recovery, that I can come only like once in 2 weeks, and so on, because I'm recovering. But I felt that I want to give it a consistency and still be coming every week, just once a week, because I feel the tremendous difference once
Yeah.
I'm doing your treatment. Like, I feel so much better. And, my work consists of those physical stuff, because my work is hard. I'm working lots with my body. Like, I'm not just standing there with the kids. I'm moving, I'm showing, just taking their arm and just guide them through the ice, through all this athletical process. So I have to be active, and I am active. So just not taking care of your body would be really silly.
Yeah, that's interesting. That's funny because most of the time I have to try and explain, continually re-explain to people. Then they have to keep coming to get a more lasting, a longer change. In your case, I tried to make you go a lot further out and come less, and you wanted to keep coming. And that's not because you have some sort of dependency. That's another point. That's something that comes across to chiropractic. That's not it at all. You have just gotten to a level for also for me and myself and my family, where you feel the benefits of just having your body at the top, its top level of performance, and having that sensation of just feeling good, feeling at the top of your game, as we say. It's not you have to keep coming back because I have to keep repeating to doing something over and over again. So that's also an interesting point that you make.
That's right. I agree.
All right, great. So thanks again for coming on.
Thank you.
And we'll be seeing each other soon.
Yes.
All
I
right, great, Maryna.
appreciate your work, Dr. Dwight. I'm really grateful. And thank you for being on this planet Earth because you're really helping people.
Thank you. Thank you very much. That's what we work for. Those kinds of gratification.
Thank
Thanks a
you.
lot. Thank you.